Let's continue with the chronic bronchitis. So chronic bronchitis, what happened? Chronic bronchitis, the main issue here is a patient presenting with a cough from the 2 year, cough from 2 consecutive year, and for 3 consecutive continuous 3 months. The cough is a productive cough here. The cough is productive cough. The muco. The mucus is not mucus there. The pus is little, not much foul smell as compared to bronchitis. The trachea bronchi is having the mucus secreting cells there. What happened during bronchitis inflammation? The enlargement of this mucus secreting cell, and they start releasing mucus. A person having the cough and also with a mucus production. What the patient presents, the first symptom here, the person having here the first symptom, firstly the person starts the symptom dyspnea, patient feeling difficulty in the breathing. What happened with the spirometry, the forced expiratory volume, because it's obstructive disease, the forced expiratory volume per minute per second here, the forced expiratory volume, this volume is decreased because the issue with only done with obstructive disorder lead to in the introduction of obstructive disorder. Well done with this condition, that the Y expiration issue there. These are the airways disease, the airway block, the problem, the patient having issue with expiration. So the forced expiratory volume is decreased. The forced expiratory volume, the expiration, the forced expiratory volume, this forced expiratory volume is depend upon we need here force vital capacity. The vital capacity depend upon the expiration also. The taking full forceful inspiration, then expire the full air, that's your vital capacity. So forced expiratory volume is a decrease, and the vital capacity is also decreased. The forced vital capacity near normal. The thing here, the forced expiratory volume, little bit reduction here, the forced vital capacity. The forced expiratory volume is reduced. So the ratio, the vital capacity, the forced expiratory volume, this ratio is decreased. This ratio is decreased. The vital capacity, because the forced vital capacity. It's a vital capacity. If we take the ratio here, the forced expiratory volume, expiration is decreased. So if expiration is decreased, it's the ratio, then the vital capacity here this value become more bigger. And then what happened? The inspiration, no issue. Inspiration, no issue. Only there's a problem with the expiration. The problem with expiration, this ratio will reduce. This ratio going down. It's important. It's a spirometry finding. It's a spirometry finding. The next thing, in this case, the chronic bronchitis, the patient is also known as a pink puffer. Once a pink puffer, and the two conditions here, one is blue bloater and the pink puffer condition. The person, the why pink puffer and why blue bloater? The blue bloater, the two conditions will fit with the COPD. The two conditions with the COPD, what's happened? The one is emphysema, one is bronchitis. The emphysema patient, they are color more pink color, and the bronchitis patient, bronchitis patient, they having the problem with they have the appearance of blue blood. They have cyanotic colors, the skin cyanotic color. Why? Because the bronchitis is obstruction of airway due to mucus plug. An obstruction of airway, what happened? The CO2 inside the body, CO2 increasing. This CO2 give to cyanotic appearance. That's why CO2 retention there. But in the emphysema case, what's happened in emphysema? In emphysema, the main issue here we having the pink puffer appearance. Why? Because emphysema lead to gas exchange. The issue with gas exchange, the oxygen is decreasing. The oxygen content in blood is decreasing, but no problem with the CO2 expiration. CO2 can be expired in the emphysema, but the O2 level is decreased. So in the body suffer from oxygenation, the deoxygenation. Now body have the little oxygen. This little oxygen will rapidly bind with the hemoglobin. Rapidly bind. When your body have little oxygen, if your oxygen quantity is less, the body rapidly bound with that because oxygen hemoglobin affinity a bit high, then a hemoglobin rapidly bound with oxygen, and now hemoglobin when bound with oxygen give you color pink. It's the pink puffer. The pink puffer belong to emphysema, and the blue blood belong to bronchitis. The bronchitis patient, if the bronchitis is prominent, then blue blood. If the like pink puffer color there, it means emphysema is more prominent. Both conditions, both are the part of the COPD. Both the part of COPD. And what happened here, the right side heart failure COPD patient at last, what they developed right side heart failure, this condition known as cor pulmonale. Any lung disease lead to right side heart failure. The right side heart failure due to lung disorder is known as cor pulmonale. So what happened? Why lung failure here? Okay, wait. Why this lung failure, lung disease lead to heart failure? We try to understand. Okay, now what happened inside the lung, inside the body and the lung? The hypoxia there, when the hypoxia because no oxygenation. If this alveoli here, we having a bronchi here, or gas exchange not well, what happened? The hypoxia. So due to hypoxia, what happened with the vessel? Vasoconstriction start. Is opposite. If the body tissues suffer from hypoxia, then vasodilation. But if the lungs having hypoxia, what happens? Vasoconstriction start. If the vasoconstriction start, it can increase what? If vasoconstriction start, vasospasm there, the shunting and dead space both increase. The shunting also increase. The shunting of blood and dead space there. The hypoxia start vasoconstriction. And the vasoconstriction, it can lead to increase in the resistance there. When the increased resistance, this resistance high, it can putting burden on right ventricle for pumping. Because hypoxia induced here, hypoxia, even that space, if oxygen is not exchanged, air just wasting, or maybe shunting there, blood there and air not there. Like in case of bronchitis, in the bronchitis, like here, we try to understand here, it's a bronchitis, mucus plug here. This alveoli not have air. If not have air, the blood is going just, it's a wasting of blood. So bronchitis lead to wasting of blood. And emphysema, what's emphysema? What's happened in the emphysema? Emphysema, destruction of the alveoli. Air is there, destruction of alveoli. When destruction of alveoli, this capillary is gone. If capillary is gone, the air is come here, but air not exchange. Emphysema increase the shunting. Emphysema increase shunting, and that space is increased via the dead space here. Dead space here, air is not coming. The shunting, sorry, the little bit opposite here. The shunting is increased in case of there's a shunting here, or the shunting is a wasting of blood. The bronchitis lead to shunting of the shunting here. The shunting of the blood is not oxygenated, and that space, the emphysema lead to increase in that space here. So the blood is not there, but air is there. The dead space. The both conditions lead to hypoxia inside the lung. When hypoxia inside the lung, this hypoxia doing what? The vasoconstriction, so resistance in the vessel increase, now putting burden on right side heart failure. The patient at last, the patient COPD patient in last stages, now they have that, they also develop the sign symptom of the right side heart failure. That's the cor pulmonale. This is all about in our next video. We will talk about the asthma in detail. I'll explain asthma, a topic and non-topic. Okay. Before going forward, we're just having quick review of the COPD. COPD is just a disease due to smoking is the main cause here. This disease present in smoker. And two part, one is emphysema, one is bronchitis. Emphysema, must keep in mind the feature. The emphysema is a disease at the level of alveoli. At level of alveoli, it can affect the gas exchange. It can interfere with gas exchange. And the bronchitis lead to, due to mucus production, it leads to plugging of bronchiole, plugging of bronchiole, it block the air. When block the air, expiration is the main issue. The CO2 retention there, CO2 retention high, so that's why these type of patient they having the appearance the blue bladder, the blue bladder. And these patient they having decreased level of oxygen in the body, but CO2 is going out. There is no elevation of CO2 level in blood, so decreased oxygen in a hemoglobin affinity for oxygen is increased. The hemoglobin give color here pink, so pink puffer is the condition belongs to emphysema. So as this disease due to in the smoking is the cause, maybe congenital emphysema, the category here, the congenital emphysema and for one antitrypsin deficiency. This is all about COPD.